As the Director of Interprofessional Best Practice and Student Relations, Lori Jennings is the face of evidence-based best practice at Bluewater Health. Lori stepped forward to engage in elevating practices at the front line so that Bluewater Health could become a best practice spotlight organization. She gained a clear understanding of where practices needed attention by listening to colleagues and patients and looking at quality-sensitive indicators. Over the past 3+ years, she has met every deliverable required by the RNAO, which included allocation of a budget to train more than 100 champions, provide workshops, and sponsor fellowships. She and her champions have attended and presented at conferences, showcasing the work that Bluewater Health has undertaken to promote evidence-based best practice. Lori is a registered nurse and a shining example of her profession. She supports innovation and quality inside Bluewater Health through her support of the clinical educators, her work on the Quality and Patient Experience Council, and her involvement in important work such as quality care reviews, the early warning scoring system, the new policy on identification of aggressive behaviors in patients, the patient care needs assessment, and the introduction of Emily. She is also an ambassador for the organization. She has collaborated with external partners to assist their achievement of their BPSO journey. She is the membership officer of the Nursing Leadership Network of Ontario. She contributes to the provincial body of knowledge concerned with healthcare leadership, and she and her team are involved in the establishment of solid relationships with colleges and universities for the placement of professional students. Lori is a wife, mother, and grandmother, and she shares her personal joy with others in a way that draws people into a deeper relationship with her. She leads by example and celebrates the accomplishments of others. Ask anyone. Gayatri Radhakrishnan is the pharmacist you want to talk to about medication reconciliation, antimicrobial stewardship, or telemetry patients. She is the guru at Bluewater Health. Gayatri joined Bluewater Health in 2011 and has since taken the lead on medication reconciliation and antimicrobial stewardship, in addition to her role as a telemetry pharmacist. She represents Bluewater Health in 3 huge roles that demonstrate how big a responsibility she juggles. The internist physician group on telemetry can attest to her meticulousness in probing into patients' medications therapy to assist their outcomes. She has assisted the nursing and physician group in doing medication reconciliation on discharge and advising patients on their medications. Gayatri was instrumental in the development of a MedRec team and the implementation of the iAtric software. This work has produced measurable results and helped us to deliver on our quality improvement plan. The percentage of medication reconciliations on admission went from under 80% to 96 to 97% hospital-wide. Gayatri leads the education for all 18 medication history technicians. Gayatri is asked by many organizations to hold teleconferences to learn about our successes here. Gayatri attends many educational opportunities to keep up in the world of antimicrobial stewardship. She is spearheading software implementation to assist in improving our stewardship program to be able to monitor more patients' antimicrobials with computer technology rather than manually. She has represented us with other antimicrobial stewardship committee members at the Windsor Public Health Forum for Antimicrobial Stewardship and also represented us at the Canadian Society of Hospital Pharmacists Professional Practice Conference. Gayatri is professional, meticulous, patient, kind, intuitive, and easy for everyone to approach and get along with. She goes the distance and is indispensable to the hospital team. As the physiotherapy and occupational therapy lead, Cindy Wilson holds her professional standards to the highest degree, and through her day-to-day practice seeks to improve the quality of care provided at Bluewater Health, and ultimately, the patient and family experience. She has been a best practice champion lead, and her role has improved patient safety across the continuum of care, as demonstrated by her work to decrease patient falls and injuries from falls across the organization. Her leadership in the implementation of the evidence-based fall prevention care plan in inpatient areas has resulted in a significant decrease in injuries from falls. This work contributed to Bluewater Health's designation as a Registered Nurses Association of Ontario Best Practice Spotlight Organization. Cindy contributes to numerous quality improvement initiatives within her own program and across the organization. She has the respect and trust of her colleagues, members of the interprofessional team, leaders, and community partners. She is considered an expert in her field and is requested for multiple projects and committees. This includes working on quality-based procedures, total hip and knee replacement, fractured hip pathways, and lead for the fall prevention team, where she works collaboratively with interprofessional teams striving to improve the patient experience. Cindy's care for Emily extends beyond the walls of Bluewater Health. She participated on the Lambton County Falls Committee, networking with healthcare providers across the Erie-St. Clair-Lynn to help bridge the gap from acute care to home. She has collaborated with many organizations, including Brantford General Hospital, participating in a fall prevention value stream mapping session. When it comes to patient safety, she never gives up, but chooses to focus on another day, another way, using an appreciative approach, keeping the team she is working with positive.